Hi everyone. Today we will discuss about the adverse drug reactions, different types of the adverse drug reactions and pharmacovigilance program of the India. To improve the patient safety and care during the use of their medications, adverse drug reactions reporting is very important. Adverse drug reaction reporting is under the program of the pharmacovigilance and that is under the Indian Pharmacopoeia Commission. So let us start with the what is adverse drug reaction. Adverse drug reactions is any noxious change which is suspected to be due to drug which occurs at doses normally used in men which requires treatment or decrease in the dose or which indicates caution in future use of the same drug. Adverse event, this is the another terminology which means any untoward medical occurrence that may present during the treatment with a medicine but which does not necessarily have a causal relationship with this treatment. So that is adverse event. So you have to identify the difference between the adverse drug reaction and the adverse event. Now coming to the what is pharmacovigilance. Pharmaco means medicine and vigilar means to watch. So you have to be very careful when you are using the drug therapy for the treatment of the various diseases in the patients. WHO definition of pharmacovigilance is the science and activities related to the detection, assessment, understanding and prevention of the adverse effects or any other drug related problem. So this is known as pharmacovigilance. Now coming to the why we need to report adverse drug reactions. So first the drugs are tested in animals and this does not always predict about the human safety of drug. After that these drugs are tested in the humans. So in the clinical trials the patients which are used they are in the limited numbers. Conditions of use differ from those in the clinical practice in the reality and the duration of the trial is also limited. So, information which is collected during the pre-marketing phase of the drug regarding the possible adverse drug reaction is often incomplete. Information about the rare but the serious adverse drug reactions, chronic toxicity studies used in the special groups, for example, in the children, elderly, or in the pregnant woman, then the drug interactions are often incomplete or not available, and this can be obtained only through the sustained vigilance. So, due to all these reasons, we have to be very careful even for the existing or the older drug or the new drug used in the general population and we have to report adverse drug reactions. Now coming to the types of the adverse drug reaction and that you can remember with the help of the very easy and simple mnemonic that is type A, B, C, D, E. So A, B, C, D, E is your mnemonic to remember the types of the adverse drug reactions. So type A is a dose related or augmented type of the adverse drug reactions. This is common. It is related to the pharmacological action of the drug. It is predictable and it is having a low mortality. Example is insulin which causes hypoglycemia. So we all know that insulin causes decrease in the level of the blood sugar. It is related to its pharmacological action. It is predictable and if you correct it by immediately decreasing the dose or if you stop insulin temporarily, then you can prevent this type of ADR. You can also give glucose as a treatment for the insulin induced hypoglycemia. Now another type is type B or non-dose related or bizarre type. So this is uncommon, it is unpredictable, it is not related to the pharmacological action of the drug and it is having a high mortality. Example of this type of ADR is penicillin induced hypersensitivity reactions. So you have to immediately stop the drug, avoid use of the penicillin in future. As a treatment, you have to use adrenaline for the anaphylactic reactions if it is caused by the penicillin. Now coming to the type C or the chronic ADR. So on long term use or exposure of the drug or due to the drug accumulation, this type of ADR occurs. For example, adrenal suppression with the long-term use of the corticosteroids. How you can manage type C reaction, that is by the dose reduction and gradual tapering. Type D is a delayed. This type of adverse drug reaction is having considerable lag time between the treatment and adverse drug reaction development. Examples include teratogenicity with the isotretinoin, and management of it includes early detection and avoid such a drug in the future. Now coming to the type E, that is end of use. This type of reaction occurs on sudden interruption of the drug. For example, if the patient is receiving beta blocker for the treatment of angina pectoris, and if you suddenly stop beta blocker, then it can worsen the angina and it can result in myocardial infarction precipitation. So this is type E adverse drug reaction, and this can be minimized by tapering of the dose. So these are the different types of the adverse drug reactions, their common features, examples, and how you can manage this type of the adverse drug reactions. Now coming to the pharmacovigilance program of the India. In our country, the Central Drug Standard Control Organization by the Ministry of the Health and Family Welfare, Government of India, has collaborated with the Indian Pharmacopoeia Commission in Ghaziabad. So in our country, Pharmacovigilance Program of India, this was initiated in 2010. So in today's videos, we have discussed about the adverse drug reactions, different types of the adverse drug reactions, why we need to report the adverse drug reactions, and Pharmacovigilance Program of India. In the next video, we will discuss about what to report, where to report, what happens to the submitted adverse drug reactions. Subscribe my channel and follow for more pharmacology related videos. Thank you.